Good now?
Yep.
Hey, y'all.
Well, good afternoon, everybody. We're all here. It's great to see my some of my good friends with me today. Charles Johnson and Allyson Felix are pretty familiar faces around these issues around mom and baby health. They have been extraordinary advocates for maternal and infant health over the course of many months and years, and we are just so grateful to have them joining us today. And it's certainly my honor to have them as a part of this panel discussion. I want to remind everybody that we will be able to take questions, and I will be able to pose them to Allyson and Charles. If you put them in the chat box, we'll be able to see them, and want to make sure you have a chance to ask questions and respond to some of the things that Allyson and Charles are raising. So Allyson and Charles, thanks for being here today. You all have been so vocal and so public about your stories. Would like for you to share a little bit about your stories today for those that may not have heard them. And I want to start with Allyson. Allyson, you have really spent a lot of time sharing your experience becoming a new mom with your beautiful daughter, Cameron. My daughters and I have loved seeing your story, have loved seeing you on your social media, sharing your experience. Can you just share a little bit about what you experienced as a new mom, giving birth, and tell us about some of the challenges you faced as you welcomed Cameron into the world?
Yeah, well, thank you so much for having me. It's really nice to be with everyone today. For myself, I had a really great pregnancy. I knew I wanted to come back to compete. And so I trained throughout my pregnancy and I felt strong. I was, still running. I was in the pool. I was doing all of these things and feeling really good. And so I had a normal appointment at 32 weeks. I went in and right away, my doctor became concerned. I was spilling protein and she wanted to do further monitoring on me. So they sent me to the hospital. And once I got to the hospital, I was admitted. And that's when things really took a turn. Quickly, things kind of spiraled. I was diagnosed with a severe case of preeclampsia. And it just got really scary really fast. I guess I had heard the statistics and I kind of, knew, but I just never, being a professional athlete and knowing my body and how to be healthy, I never saw myself in this position. And so when I was really confronted with this problem, it just I wasn't prepared. I don't think anyone is ever prepared, but I just, my mind wasn't there. And quickly things kind of just kept, getting out of control and came to the point where, they had to make some really fast decisions and took me in for an emergency C-section. And, I think it was really scary for my family, kind of not knowing what was going to happen. My life was in danger and my daughter's life as well. And, went in to deliver and I stayed in the hospital for a while after, still fighting some of those same complications. And my daughter was in the hospital for about a month in the NICU and fighting herself. And so a really scary situation, but we feel so blessed to have come out on the other side of it. And having come out on the other side, my eyes have just been open to what an enormous problem this is and how many people don't walk out of the hospital. And so that's why I think it's so important to share these stories of what is happening. Because, I think you can hear a lot about it, but once you do, someone or know someone who's experienced loss, it really changes things for you.
No, absolutely. And thank you for sharing that. I want to come back to you. But I want to turn it to Charles. And Charles, you've had an equally painful story and very challenging story with Kira, your wife, and in her delivery with Langston, so your second boy. So can you share a little bit about that story and make sure everyone knows what your experience has been as well?
Sure, absolutely. So first and foremost, just Stacey, thank you so much for having me. Thank you to your entire team. It's just awesome to be here with what truly has become like my second family, right? With you, with, Auntie Alma Adams, who's coming on later this afternoon. Allyson, we have not met, but I adore you, and I'm so grateful for all the work that you were doing on behalf of families. And I saw your post that you just started training for 2021. Me and the boys will be there. We're coming to Tokyo, right? We will be there. We will be there to support, screaming super loud for you. So, so let's jump into it. So my wife, Kira, truly was, and I know those of you who have heard me talk before know that I can brag about Kira all day long. We're talking about a woman who ran marathons, who spoke 5 languages fluently, who had her pilot's license, who was a skydiver, who was truly just sunshine personified. So we welcomed our first son, Charles, in 2014. We had always talked about having back-to-back boys, right? So we were just so grateful when we found out we were expecting our second son, Langston. We recently relocated to Los Angeles, California. And part of the painful irony of what I'm going to share with you is that we chose to deliver at Cedars-Sinai because it was our understanding that it was the best place to give birth. It was supposed to be one of the best hospitals in California and possibly the country. So at our doctor's recommendation, throughout Kira's entire pregnancy, she had been perfectly healthy, other than just a touch of nausea. All signs pointed to both her and Langston being extremely healthy. So on April 12th of 2016, very importantly, at our doctor's recommendation, we walked into Cedars-Sinai for what we expected to be the happiest day of our lives and walked straight into a nightmare. Langston was born perfectly healthy. Shortly after the delivery, they take us back to recovery. And that's when things begin to take a turn for the worse. Around 4:00 in the afternoon, I noticed blood in Kira's catheter. I brought it to the attention of the doctors and the nurses at Cedars. They came in, they assessed her, they examined her, and they said they were going to do several things, including a CT scan that was supposed to be performed stat. In the interest of time, I'm going to condense this story so we can get to these questions, and this, what I know will be a very fruitful conversation. Kira was allowed to suffer and bleed internally for 10 hours. While we begged and pleaded the staff at Cedars-Sinai to take action, and we got this runaround. For 10 hours, she was allowed to suffer. For 10 hours, she was allowed to lie there in excruciating pain while we advocated, did everything we could to get them to take action. By the time they finally took Kira back to surgery, keep in mind, we went in for the delivery at 2:00 in the afternoon. It was 12:30 the next morning. When they opened Kira up, they found 3.5 liters of blood in her abdomen for where she had been allowed to hemorrhage and bleed internally for 10 hours. They worked on her for some time, but they weren't able to save her. And I know we'll get into it, but Kira, much like many of the mothers all around this country, deserves so much better. And that's why I'm proud to be here with you today.
Yeah. Well, and every time I hear both of your stories, it just reminds me of, you know, what we have to do to make this system work better for all moms and all babies. And, you know, I know I speak on behalf of a lot of folks that are joining. We're so sorry for the pain you've gone through, the losses you've experienced. You know, these are things that just shouldn't happen in 2020 in the wealthiest country in the world. Absolutely. Allyson, I want to turn back to you because, you know, I think what's really interesting about both of your stories, Allyson, you're an Olympian, you're an Olympic athlete. And if anyone didn't notice, just look at her necklace to tell that. But we all know you, and we know you are at the peak of your health, and you were when you were giving birth to Cameron. We know Kira was in excellent health. So why are these things happening for women who have access to the best medical care in the world, Charles, as you mentioned? You know, women that have access to resources, but these are women of color. Allyson, you as a woman of color, Kira. So Cameron, you know, Allyson, sorry, what would you say is your biggest plea as a woman of color to the healthcare system to address these issues that we're facing?
Yeah, I mean, I think the thing that just really stands out to me, and again, listening to Charles' story, and it's just so heartbreaking because these things are preventable. And I think I would say the biggest thing that I hear is that we're not being heard. You know, I think we're bringing our pain out there and we're having to advocate for ourselves. But that shouldn't even have to happen. You know, you shouldn't have to be screaming that something is wrong to be able to get attention brought to these issues. And I think that's one of the major problems. It's already intimidating enough to go into a doctor's office and here is someone that you should be able to trust. And, you know, they are the experts. But when your pain is not, you know, being heard, it really gets to a scary situation.
Yeah, and can I just ask a question that's come in, Allyson? I probably wasn't supposed to do this, but I do want to make sure people know I'm seeing the questions. Question for you, Allyson. What, if anything, do you think could have been done to prevent what you went through? That was a question on Facebook.
Yeah, I mean, I really feel like, you know, right away when you are going into your doctor's office, knowing that you're at risk. I think that's number one, you know, and that's why I think awareness is so important, and why these conversations are so important because, you know, it might not have changed anything, but knowing the signs to look for, you know, knowing the swelling or the things, you know, that could happen and being able to, you know, put in place a person, you know, whether that's your partner or whoever it is to make those decisions when things really take a turn. All of those things are helpful so that when you do find yourself in that position that, you know, at least there is a plan in place and, you know, you can move forward in that way.
Yeah. And Charles, you have turned your pain into incredible advocacy and action. And both of you all are doing this outside of your day jobs, right? I mean, you have families you're trying to raise, you have professional pursuits, you've got a lot of things going on, but you're spending a ton of time on these issues. How did your experience kind of propel you into this place of advocacy? And tell us a little bit more about why you are such a proponent of blanket change, this effort to address the policy changes that are needed.
Sure, absolutely. So for me, Stacey, frankly, when we walked into Cedars-Sinai on April 12th of 2016, the notion that Kira would not walk out to be here to raise her sons, it never crossed my mind, right? I was like a lot of Americans, I was oblivious to the fact that this was even going on. So when this first happened, of course, my world was shattered. But then as I began to hear these stories of other women, right, who had very traumatic birthing experiences and near misses like Allyson, or other women that had died in childbirth, I'm beginning to think to myself, something isn't right. And that's when I did the research and I was just blown away by the fact that we are in the midst of a maternal mortality crisis that is so shameful. But not only was I shocked by the fact that we were in this crisis, I was even more appalled by the fact that nobody was talking about it, right? That this was America's dirty little secret. And so I felt like I had to do something. I didn't know what I could do. I didn't know how I could make an impact, but I felt like I owed it to Kira and I owed it to my sons to do whatever I could to raise my voice, to try and prevent our nightmare from becoming other families' reality. So that's how I began to advocate. And honestly, I didn't know what to expect. And, you know, I probably naively thought that I would share Kira's story. And if people took notice, and if we got a couple people to write some articles or to say stuff about it, it would be great. And then I would go back to being a soccer dad in obscurity and trying to raise my boys. But God and Kira had very different plans for my life. And so moving forward, once we began to get traction and to raise awareness, I really wanted to figure out what we could do to create substantive, long-lasting, institutional level change. And so it's when I began to advocate for policy. I was fortunate enough to work in partnership with you in the March for Dimes to get HR 1318 passed, which is the first ever federal piece of legislation to prevent women from dying in childbirth. And so when we talk about where we're at now, at this pivotal moment facing the eve of the 2020 election, it is so critical that while we talk about all these issues that divide us, we come together around an issue that can uniquely unite us, and that is the health and well-being of mothers and babies in the United States. I don't care if you were with, you know, I say this all the time, Stacey, I don't care if you were with the Republican Party, the Democratic Party, the After Party, I don't care who you were rolling with. When you roll up to the polls, you need to demand that if somebody is going to get the privilege of your vote, that they have a comprehensive plan, even on the local level, the state level, to make your community, your state, and this country a better place for mothers and babies.
And we're so grateful for your advocacy and you being a part of Blanket Change and all the other work you've been doing, testifying on the Hill. Charles, you've been a very powerful advocate for sure. And again, we want to remind everybody that if you want to be involved in blanketchange.org, just go to Blanket Change, but in Blanket Change and policy change, go to blanketchange.org and be a part of this movement. I want to touch on one last issue, which is, we talk about what the healthcare system needs to do differently, but within Blanket Change, we're talking about what moms and families and babies need, to be able to live a healthy life. And one of the things that really has come out in your experience, Allyson, has been around what employers and what this country needs to do to support moms before birth, during birth, after birth. Paid family leave is really an important issue, and you've been a big advocate for it. We are one of the only industrialized, if the only highly industrialized country that does not have a national mandate for paid family leave, which is really incredible. And this puts enormous stress on women, working moms. We did a study, the March Dimes, that showed 1 out of 3 women said that if without paid family leave, that they would have to leave their jobs after 1 year of having the baby. That destabilizes the financial stability of a family. It takes a woman's takes a woman off track from her career and professional growth. Talk about, Allyson, if you can, just briefly, the importance of paid family leave and what employers need to be doing. And I know you have a personal experience around this of advocating, demanding for the kind of support from your employer or someone very much supporting you financially. Can you talk about the importance of paid family leave in this country for families and women?
Yeah, I mean, I think it's crucial and it definitely has to be addressed. In my own experience, you never know what type of birth you're going to have or what complications you're going to face. But regardless, the time after you give birth can be very difficult. Postpartum is it's very interesting of the emotions and all of the things that you go through, and also the time to bond with your child. And it's not just an experience with a mother, but it's a whole family, so that's why this is so important. But I just recall, after having my daughter and sitting in the NICU, which is such a heavy place to be already, and trying to be there and support her and still dealing with my own health. But in the back of my head is also that I need to get back on the track, that I need to do all these things because my livelihood depends on it. And I think about all the other mothers, across industries who have these same issues, who are going through all of these same things. And it is a really, really difficult thing to be pulled in all of those different directions when your heart is with your family and spending that crucial time together in those precious moments. So it's an area that we have to do more. And, I felt like it was really important for me to share the challenges that I was facing with my employer and what I had seen throughout my whole career surrounding pregnancy in the culture, and how women felt they had to really kind of be silenced in order to secure their livelihood. And I just never want anyone else to have to go through that experience that I did, and that so many other women have and are still going through.
Absolutely. I know we need to end this discussion. I wish we had so much more time. But Charles, just to bring this to a close for both of you all, I'll start with Charles. What is your wish for changes in this healthcare system? If you are again in front of policymakers and in front of the American public, what do you want them to know, especially with the November elections right upon us, right? What do you want them to know? What do you want them to understand about moms and babies today? And what change do you want them to really push for?
There is nothing that can replace a mother, period. And that for all our riches, for all of our accomplishments, for all of our international bravado, if we are not protecting mothers and babies in this country, then what are we doing? The right for a mother to give birth to a child and then be around to raise her. It's not a women's health issue. It's not a maternal health issue. It truly is a human rights issue. And we have to do everything in our power to frame the conversation as such. And I also want people to understand that the other thing about this, while it seems like there's a lot of dragons for us to slay, at the end of the day, be encouraged if you believe in this work and you're on the front lines, because the great thing about it is this is something that we can fix, right? This is something that we can fix in our generation. I refuse for this to still be a problem when it's time for my boys to have babies. I refuse for this to still be a problem when Cameron decides to have a family of her own, right? Our time is now. But we have to be assertive. We have to keep pushing this conversation, and we have to not ask, but demand. And that's why I love that you framed it like this, Stacey, because I know that probably was up for demand change. We're way past asking. It's time to demand change and demand better.
Demanding change, that's right. And Allyson, just to close us out, what do you want to say to the public and policymakers about what we need now?
Yeah, I mean, I just really echo what Charles just said. Charles, I think your advocacy is so inspiring.
Thank you so much.
To speak, and we're just so grateful. And I think we have to keep sharing these stories, keep these conversations going, because we have to be heard. You know, women of color, we should not have to advocate for ourselves, but we do. And like Charles said, this is preventable. And so we have to keep pushing forward to create change.
Absolutely. Well, it is really an honor for me to be with both of you all today. And we're so blessed to have both of you all as a part of this. And I know our work is ongoing. It's going to continue, and it won't stop until we get to a place where every mom and every baby has a chance to be healthy, and every baby has a chance to grow up with his or her mom. And that is our aspiration, and that's what we're all fighting for. So thank you all so much for joining us today, and it's a pleasure to be with you.
Thank you so much, Stacey. Thank you, Allyson.
Thanks, Charles. Thanks for having us.
All right. Thank you so much.
Thanks all. Appreciate it.